as you're aware, Chikungunya was first reported in the Caribbean region in December 2013. Since that time, the Ministry of Health has sent a total of 62 samples to the Caribbean Public Health Agency, CARPHA, in Trinidad. These were sent for testing, of course. These samples were taken from patients who were showing symptoms of chikungunya. I would like to take this opportunity to bring you up to date on what we know about chikungunya disease in Barbados at this time, and what actions are being taken by the Ministry of Health to manage the situation, as well as what the public can do to protect themselves and their families. Based on testing conducted by CARPHA, Barbados has now recorded its first confirmed case of chikungunya. This was one of 7 samples sent to CARPHA last week for testing. This is an imported case. The point must be made, this is an imported case, which occurred in an individual who arrived in Barbados on May the 25th and has already traveled back to their home country. Vector control measures were implemented last week based on suspicion of chikungunya. Members of the public are advised that simple control measures can be taken to protect themselves from being bitten by mosquitoes. These include spraying inside their homes with insect repellent to kill adult mosquitoes and getting rid of containers, buckets, tires, coconut shells, and other places where mosquitoes can breed. Using insect repellent on your skin and wearing light-colored long pants and long-sleeve shirts when outdoors are also recommended. Chikungunya is a virus similar to dengue and is transmitted by the Aedes aegypti mosquito, as well as the Aedes albopictus mosquito. The symptoms are similar to dengue fever and may include a sudden high fever, headache, rash, nausea, and muscle pain. However, stiffness and severe joint pain, especially at the wrists, knuckles, or ankles, are more often associated with chikungunya. Fever may last from a few days to a few weeks, and some infected patients have reported debilitating arthritic pain persisting for weeks or months. There is no vaccine for chikungunya. Treatment is symptomatic and may include rests, fluids, and medication for fever and pain. However, aspirin should be avoided. I'm appealing to all householders to inspect their premises on a weekly basis to make sure that there are no places where water can settle, and to eliminate all potential mosquito breeding places. This is one of the most effective actions which members of the public can take to prevent the spread of chikungunya. Finally, our public health officials will continue to undertake all protective measures as are needed at this time to address this situation, including fogging, enhanced surveillance of ports of entry, collection and analysis of data from the various public health care facilities, health education, and other source reduction activities. I want to again encourage all Barbadians to cooperate with the Ministry of Health by following the public health guidance which is given by us and the officers who are placed in the position of leadership in this regard. I thank you.
The Ministry of Health is advising members of the public who will be traveling to areas where chikungunya cases have been reported to take the following precautions to avoid being bitten by the Aedes aegypti mosquito, which transmit the disease. We need to use insect repellent on your skin. Sleep under a bed net. Spray indoors with insecticide to kill the adult mosquitoes. So if you're staying in a hotel room or whichever room you're staying in, spray it before, as we do here. You close it up, you spray, you go out for a little while, and then you come back in. That will kill all the adult mosquitoes. If you are so lucky to have an air-conditioned room, mosquitoes do not tend to live in them, but you can also spray your air-conditioned room. So you've gone and you visited, and you've come back home. We want you to consult your doctor if you develop any of the following symptoms when you return home to Barbados. If you have a sudden onset of fever, muscle or joint pains, headaches, or just feeling ill and loss of appetite. So these usually begin 3 to 7 days after being bitten by the mosquito, the infected mosquito. So depending on when you come back, if you come back and within 7 days, then if 7 days have passed, usually you're clear. You haven't developed it. And as Minister said, do not take aspirin, because aspirin will cause other complications like bleeding, which you don't want, okay? So basically, we are saying we cannot put a travel restriction on anyone, but think carefully before you travel, and if you do travel, please take the precautions that I've just outlined.